Welcome. My name is Prue Morgan. I'm going to kick off this session. My background, I'm a physiotherapist and a researcher, and obviously I have a particular interest in ageing with cerebral palsy. So today we're going to explore what is early ageing, how often does it occur, why does it occur, what characteristics of cerebral palsy might make it more likely to occur, and what can you do about it? So first of all, what is early aging? Early or premature aging just means that a person presents with signs of aging before they actually meet what we would traditionally consider old age. And it may include decline in mobility or loss of strength or bone density. People might experience an increase of falls or pain, a loss of flexibility or fitness. Some people have reported a decline in memory, increased difficulty in swallowing, or sometimes difficulty in breathing. Generally, those signs in cerebral palsy can start occurring or be apparent any time from sort of the age of mid-20s onward to maybe around sort of 40 or even 50. Next slide. So how often does it occur? Most of our knowledge about early aging relates to change in motor function. That's what most of the research has reported on. So for example, it's reported how many people might reduce the distance that they're able to walk, or they may stop walking altogether, or they may need to start or change the type of walking aid that they use. In terms of the data, we know that maybe up to 40% of people who were able to walk during childhood may lose that ability to walk in early to middle adulthood. And we also know that around about a similar number, so let's say 40% of middle-aged adults with CP describe lower bone mineral density, and that's worse than their sort of without disabilities. And obviously that's important because of the risk of fractures. We also know that, changes in drinking, swallowing, or mealtime management is also reported to occur in those as they hit sort of 30 and onwards, particularly in those who might already have experienced prior dysphagia. Now, this graph has been around for a long time, and it sort of tracked people's gross motor abilities from, say, the age of 0 up to about the age of 18. And you can see from that those who have more severe types of cerebral palsy, so GMFCS level 3, 4, and 5, tended to start to experience some sort of decline in their motor function from around about sort of late adolescence. However, this information wasn't that helpful if in fact you're an adult. Thanks, Wade. So in fact, we've now got a bit more information that we can now start to track. Well, what happens after the age of 18? In this study that was done in Scandinavia, 105 adults with CP who were able to walk were reassessed at time sort of 0 and then 7 years later. And about half reported some sort of deterioration in their walking over that time. And again, perhaps not surprisingly, the people who were more severely affected did experience or report greater decline in their motor function. And in that graph, you can see the little dotted line shows that in fact, if you had bilateral CP, so perhaps spastic quadriplegia or diplegia, you experience earlier decline than if you had hemiplegic cerebral palsy. Similarly, when we're looking at what happens to bone density and aging in people without cerebral palsy, which is the black line, we typically see as they get older, go through adolescence, they build or strengthen their bone density. It then sort of plateaus off and then starts to decline again in maybe 50s and 60s. However, what we see in cerebral palsy is not as much. They never get as much bone density, so their bones are never as strong. And so consequently, that drop-off happens more significantly and can have much more serious consequences in terms of fractures. So why does it occur? What's going on? We're going to have a look from a few different perspectives: biological and physiological changes, biomechanical changes, and functional changes. So first of all, what's going on at a muscle level? First of all, we know that muscle size in people with cerebral palsy of all ages may be smaller than their peers. We also know, if you were to look under a microscope, that muscles in people with CP may have more fat embedded within the muscle, or a greater percentage of sort of non-contractile tissue, which is the important tissue that generates power. And those muscle cells might be shorter and stiffer. Also, we find that their muscles aren't able to repair themselves as efficiently, and the ability of the muscles to use nutrients may also be impaired. So these sort of changes or differences in muscle structure and metabolic function can contribute to a greater likelihood of functional decline. Biomechanically, we can see that things such as contractures, spasticity, uneven leg length can alter and affect walking efficiency, which makes your bones and muscles sort of wear and tear more rapidly. We know that pain can cause, as well as be a result of, different loading of the joints, causing often to resulting premature arthritis. There's often a lifespan response to having quite an effortful walking pattern, which again often results in poor fitness capacity. Some people might report some problems with joint stability, and most commonly that's unstable hip joints. Some people may also find that they're having to walk much more slowly with shorter steps because of the lack of confidence in balance. And we know that people who walk more slowly and with shorter steps, that does correlate with a greater risk of falls. And if we look at some of the functional changes that are associated with changing, again, all of these in isolation or as a cluster can contribute to early gait or mobility decline. Things such as cost of walking, loss of strength, a reduction in motor control, declining balance, a reduction in physical activity because you're not feeling that you can participate as easily, and perhaps not surprisingly, falls and a fear of falling can result. When we asked people who had experienced a mobility decline, what did they think was the main cause or causes of that mobility decline, they similarly came up with a list of issues that we had already identified. Things such as, balance problems, pain, fatigue, stiffness and weakness, fear of falling, falls, fractures. But again, people reported that they felt they had a lack of physical training opportunities. They also described sort of insecurity or becoming quite anxious when walking. And all of those things are said either in isolation or together resulted in mobility decline. In terms of what we know contributes to the onset of early aging, obviously the older you are, the more likely you will experience it. And in particular, as I showed on an earlier slide, most people describe their first sort of experience or noticing motor decline in their 30s and 40s. In that study that I showed you the graph of earlier, the median age was 37 for people with bilateral cerebral palsy and 52 years old if you had hemiplegic cerebral palsy. But essentially, once people were over the age of 45, almost 70% of people with CP reported some type of mobility decline. Being less independent in gait or mobility also contributed to earlier onset. Bilateral motor impairment, again, if you've got spastic diplegic or quadriplegic, you experience motor decline earlier. Higher levels of pain and fatigue, and also some medications that obviously people with CP have to be on for other reasons can also impact early age decline, such as anticonvulsants we know do affect bone density. So we're now going to hand over to my colleague Carly, who's going to sort of experience a conversation with our colleague Wade. Over to you, Carly.
Thanks, Prue. I'm Carly Holmes. I'm a clinical and research physiotherapist that works in the field of cerebral palsy and more specifically with adults that have cerebral palsy. I'd like to reiterate Prue's point that the ageing process will be different for everybody. Wade, who will come in a moment and introduce himself, Wade and I are going to have a bit of a chat about his experience of ageing. Wade, would you like to say hello?
Yes, hello everyone. My name's Wade Costley. I'm the website information officer at MyCP Guide, and I'm also a lived experience board member at Cerebral Palsy Australia. And as Carla said, we're going to have a chat about premature aging because I'm actually going through it right now. So, Carly, do you have any questions for me?
Indeed, I do. So, Wade, with the value of hindsight, what would your 20-year-old self have liked to have known about aging with CP?
Well, hindsight's a wonderful thing, isn't it? But ideally, I'd like to have known that adults with CP tend to experience the symptoms of aging much earlier in life than those without CP. I didn't know that, and of course, I realize that this is a relatively new topic and not much is known about premature aging and CP. However, I do hope that more funding is provided for researching this subject, especially given that the life expectancy of people with CP has greatly increased over the last few decades.
That's right, it has. And Wade, what were the first things that you noticed that made you a bit concerned?
So around 5 years ago, I was going into the office every day and living, just normal life. And I was often lugging around a laptop as well. I was in IT. But in the back of my mind, something told me that, that in a few years, I maybe we had to work from home maybe 1 or 2 days a week. There were subtle things that I noticed. For example, I could tell that the daily commute was slowly becoming more tedious. I also noticed that I wasn't able to avoid falls, like in the case of tripping over things like I used to. And then as time went on, I noticed that my overall stride was gradually becoming shorter, and I wasn't able to walk as far without experiencing pain, especially in my hips and legs.
Okay, Yeah, interesting, Wade. So ageing for you's had a major impact on your mobility. Other people may have different signs such as fatigue, increased muscle stiffness or spasticity, different pains to the usual ones they experience, or maybe just a vague awareness that something's a little bit different or not quite right. So Wade, when you were experiencing these changes, did you go and see anyone about them?
Yeah, I did, Carly, because they were becoming more pronounced. So I saw a physio that had a special interest in CP, and she was the first one to explain to me how premature aging is associated with cerebral palsy, and that this premature aging is a degenerative condition. And in the past year or so, I've also engaged a rehab physician who has an interest in spasticity. And he's been a great help. And he's working with my current physio in developing like a comprehensive strategy, if you will, for managing the symptoms of premature aging. And in addition, Carly, I'm also seeing my GP on a regular basis. And when I see him, I'm telling him about what, my rehab physician and my physio have been discussing as well.
Okay, great. So health professionals, like any professionals, have different levels of knowledge, experience, and interest. So before going to see one, if possible, do a bit of checking before seeing someone new. Maybe call and talk to them, check out their websites, ask other people who may have seen them about their knowledge in regards to adults and cerebral palsy. And Wade, in regards to your GP, did your GP know much about CP when you first started seeing him?
No, Carly, he didn't, and he still, doesn't know a whole lot. In my experience, and I'm sure that this is the experience of other adults with CP, GPs often don't know a lot about CP because, well, they're general practitioners after all, but yeah, I think that there's still a lack of awareness and understanding about cerebral palsy, especially in adulthood, much less about the association with premature aging. And fortunately, my CP guide has recently published a fact sheet and a suite of other resources for GPs and other health professionals. And hopefully, this will help raise awareness within the community. And in addition, the website includes links to the websites of the Australian Physiotherapy Association, the uh, Occupational Therapy Australia, and Speech Therapy Australia. And on those particular websites, you can actually search for those respective physios, OTs, and species who have a special interest in neurological conditions. And this can potentially help assist both you as a patient doing your research, as Carlene mentioned, and your GP find someone suitable for you.
Yeah, so there's some really great resources out there on the MyCP Guide website, and it also includes fact sheets for GPs working with CP. I think a GP that's willing to listen to you, learn, and take on board resources that you can direct them to is very important. As Wade said, that they are general practitioners and they're not specialists. So don't be concerned or worried to help your GP learn about cerebral palsy. as after all, you are the expert of knowing your own body and if it's changing. They can then use that information and direct you to the appropriate people for help. And signs of aging may not occur in isolation either. So, Wade, have you experienced any other issues alongside the decreased mobility affecting your health and well-being?
Yeah, I definitely have, Carly, especially as this premature aging has progressed. So, along with the initial, overall decrease in mobility, I've also experienced pain and associated fatigue more often. So, this in turn has resulted in me having to plan out my activities for the week. So, kind of in effect setting up like a energy budget for the week. And so that's resulted in less overall socialization and going out that I used to have, say, a few years ago. And interestingly, this pain and fatigue often seems to occur in waves whereby I'll have normal energy levels for a few days, and then unexpectedly I'll just crash all of a sudden. And, and I'll experience pain and fatigue for a couple of days. I need to rest and everything. And then I slowly build up my energy levels back to normal again, doing more and more each day. But fortunately, though, the strengthening exercises that my physio has given me has actually helped reduce the frequency of these energy drops and decrease the overall amount of pain that I feel, which is a good thing, Carla.
Yeah, it is. And I think those crashes that you describe, Wade, may be familiar to many other people. Often people talk to me about if they've done something additional or different, or maybe just their normal life, that the next few days they, may have to crash too. So Wade, do you have any advice for people aging with cerebral palsy?
Yeah, I do, Carly. I've been experiencing this, this now for, probably 3 years, 4 years. So I do have a few items of advice. First of all, as I mentioned earlier, the initial signs are very subtle, and you might not realize it at the time, but as soon as you start to notice these subtle changes, for example, falling more, or you get fatigued more often, or your mobility is declining overall, go have a chat with your GP, because they can run tests to check for any other underlying issues that may be causing these symptoms. And in addition, you can ask them to find a physio who has an interest in neurological conditions. And as we mentioned before, you can do your own research as well to help them. And the physio can then help determine what might be causing the issue, and design an exercise program for you to address those changes. And certain physios can even offer home visits. So, for example, for those of us with CP, such as me, who don't drive, they can visit you at home instead of you having to travel to their clinics, which is a great benefit. So I'd say that's the first step. And then, if these issues or symptoms persist or get worse, you can ask your GP to help refer you to a rehab physician who has an interest in neurological conditions or managing spasticity. And then they can work with your physio and also potentially prescribe medication that can also help improve your quality of life. And, I for one, know that, premature aging can be a confronting experience, especially, concerning everything we go through during childhood and adolescence in regards to physio, OT, speech therapy, also, sometimes multiple surgeries as well. So if you find yourself feeling depressed or anxious because of these changes, you can ask your GP to refer you to a psychologist because they can be really helpful in, assisting you to help maintain a positive mindset and continue to be proactive. And I would say overall, in order to maintain quality of life for as long as possible, it's crucial that adults with CP continue to keep moving and also remain as active as safely as possible as they age. It's also important that they be proactive and advocate for themselves and find, allied health professionals that they feel comfortable with and who had their best interests at heart. And I know that we've talked a lot about a lot of different symptoms in the last few minutes. And, it might seem overwhelming at times to know who to see for what symptom. So I'll go ahead and share my screen. I went ahead and developed like a rudimentary metrics of that lists some of the symptoms that you may experience as a result of premature aging, and those are on the top. And then also along the left-hand side are the various types of health professionals and clinics that can potentially help with those symptoms. Now, some of the health professionals and a lot of the clinics require a referral from your GP to see them. So I've highlighted those rows in yellow. So the rows in yellow basically mean they need a referral. But I just thought it'd be helpful to see at a glance that for any one particular symptom, there might be more than one health professional that can help you address those symptoms. So I'll go ahead and walk through my own experience that I've been talking about, just to give you an idea or an example. So got my pointer here. So as I mentioned, it all started out, I was having loss of mobility, fatigue, and pain. So I went to go see my GP about these symptoms. And then he went ahead and said, hey, well, see a physiotherapist about this. So he referred me to a physio, and then the physio and I talked about, what exercises I could do to help strengthen, myself overall. But in addition to that, she also recommended that I see a rehab physician to go talk about the medication that I currently take for managing my spasticity and see if there would need to be any changes there. So I went back to my GP and got a referral for a rehab physician to look at my current medication, but also I had talked to him about the symptoms of loss of mobility, fatigue, and pain that I was experiencing. Now, he also does ultrasounds on my leg muscles, so he can actually see and show me which muscles I'm overexerting, and then which muscles are not being properly utilized. And he can relay all of that information back to my physio, and then she actually says, okay, and she gives me exercises that actually help strengthen the muscles that are not being used properly. So in basically doing all of that helps me move more efficiently, and it also helps improve my gait. But the overall, I guess, thing that I want to communicate about the metrics is that, as we talked about, a lot of these symptoms do not occur in isolation. There is, some kind of an interrelationship between those, and also that multiple, different types of health professionals can help you address those symptoms. So, Carly, would you want to elaborate more on the interrelationships between those symptoms?
Sure. Thanks, Wade. There's not that much more to say, except that there are interrelationships between the various issues that you may be experiencing. For instance, pain may be associated with fatigue. Falls may cause anxiety. Anxiety may affect your sleep. If you're doing less exercise, that'll obviously affect cardiovascular function. So there's a lot of interrelationships. It's not, it's never simple with cerebral palsy, as you'd know.
Yeah, definitely.
And and also, again, just reiterating the point that the GP is often the conduit for referrals to other specialists. And again, we all have different skill sets and different interests. So if unsure, like I said before, speak to someone, ask for recommendations, and do a bit of research. And in conclusion, really, it's about being aware, being proactive, and seeking advice. And alongside all of that is to ensure that you don't neglect all the regular health screens with your GP that we all need to do to check for lumps and bumps and cardiovascular health and so on. So I think that's it from us. If we can hand over to you all now, and if there are some questions for us.
Thanks very much, everyone. Just before we jump into the question and answer segment, I just wanted to quickly mention My CP Guide. So if you're attending this webinar today and you're not familiar with My CP Guide, it's a completely free to use website that provides an information hub all about cerebral palsy. And it is a collection of many resources that are applicable throughout all stages of life, from infancy through to older ages. So if you're not familiar with the site, please check it out at mycpguide.org.au. So we do have a couple of questions here from attendees in the Q&A segment. The first are both relating to exercise for people with cerebral palsy, and one is a little more complex, so I'll just ask that first to the group. The question says, we know that all people lose muscle bulk as they age, and people living with CP have less muscle to use. Is there any evidence that continual strength exercising throughout life of individuals with CP will prevent, reduce, or delay symptoms? Or is it inevitable that we need to manage symptoms as they arise?
Are you happy, Carly, if I speak to that? So great question. What we do know is that, number one, that strengthening exercises will not damage your muscles. Some people are concerned that there may be a bad consequence if they do strengthening exercises, and there is no evidence to suggest that in cerebral palsy. Secondly, we do know that in everyone, whether you've got CP or not, everyone can benefit from engaging in strengthening exercises. And the same applies for people with cerebral palsy. You can increase your strength in your muscles. Now, the issue in cerebral palsy is how much can that strength be improved? And that is going to be very variable and be very dependent on how severe your cerebral palsy is and what muscles we're talking about. But ultimately, we do know that engaging in strengthening exercises can, if not improve your mobility, it can at least stave off or reduce that decline that we see. So there is quite a bit of evidence now to show that we can maintain strength by doing strengthening exercises, if not get some improvement. I'm not sure, Carly, if you wanted to add anything to that.
No, not really, except that there's also exercises for people that don't have as much function, and that's really important to consider as well, even if it's passive physical activity. So there is movement and exercise for everyone, and it does have benefits.
And there's one thing that I'll add, just from my own lived experience. Often people think of strengthening exercises as just the, traditional physio, but, in my mid-30s, I was starting to feel pain in my legs, and during uni, I used to ride a tricycle between campus and home. So I went ahead and got what's called a recumbent tricycle about 12 years ago, because I really enjoy cycling. It gets me around a lot quicker than walking does, trust me. So, and I really enjoyed it. And then that got me to socialize with other people. And I've done Ride Around the Bay, which is a bicycle ride here in Melbourne, done that twice. So things like that can also help keep you, especially in my case of spastic diplegia, of keeping your legs strong and helping kind of delay that onset a bit.
You're on mute.
And Oliver, you're on mute.
Thank you. Sorry about that. We have another comment from someone saying, thank you for the informative presentation. I also valued the real life examples of ways to manage aging. And they have a two-part question. The first part has mostly been answered by the conversation you've just had, so I'm just going to ask the second part. Considering higher rates of preventative conditions like diabetes or heart conditions, I also wonder about regular preventative healthcare, for example, cardiovascular screening when above a certain age. Do you know about people's experiences in getting these?
Again, a great question. And in fact, at the moment, we're doing some research where we're looking at reasons why people go to their GPs when they have CP, and trying to see if in fact they're getting those really important screening things. So things like We know that people with CP have a higher incidence of diabetes than people who do not have CP. But are they getting screened more frequently? But the short answer is we don't actually know. And so absolutely, that's a piece of research that we're doing right now. So hopefully in the next year, we'll be able to give you more information on that. The other thing is that some of the screening that Carly alluded to before, so things like mammograms or cervical cancer, you know, are also really important if you've got cerebral palsy. Like, just because you have cerebral palsy doesn't mean you can't get any other condition. And in fact, we're starting to try and investigate, are those routine screenings and tests being done? Because absolutely they should be.
Yes,
Thanks.
except we also know that for people in wheelchairs, it's really hard to get them done because not all GP practices are wheelchair friendly, and they don't all have hoists and plinths. So they need to be done, but it's not easy.
Yep, absolutely.
Thanks, Prue and Carly, for that answer. We have another question here saying, do you have any advice for physios on how to approach this issue, aging, with our clients, particularly young adults and adolescents with CP, about building good physical activity habits early?
Would you like to take that, Carly?
Sure. I think with all of the population, that we sometimes don't start to take care of our health until it starts to decline a little bit. So with you know, young adults with cerebral palsy, it's important for them, as we were saying, to be aware of the signs and symptoms of aging, and to be aware that they may occur earlier, and that, you know, the impacts, you know, could have quite a serious impact on their functional status, and that things can be improved and changed. So it's worth taking those steps. But I would also advocate, as a physiotherapist, not for a lot of physiotherapy, but to consider, you know, daily physical activity, you know, guided by a physiotherapist, but things that you can do yourself. Any additions, Prue?
No, just absolutely. Obviously, we're trying to get the message out about aging and cerebral palsy. You know, information is really important. And if no one knows about it, as Wade alluded to, he didn't know what was going on with his body. So we're very much working hard on trying to disseminate information about aging with cerebral palsy, provide resources about aging with cerebral palsy, so that they can use it in things such as transition clinics, so that, you know, they can start to sort of highlight what the future might hold. If you're perhaps working with a 17-year-old, you know, it's a good time to start to think about, you know, lifelong physical activity and what things they might look out for. But as well as that, we need to educate our health workforce. And so again, where certainly I know at my university, in my physiotherapy program, we don't teach cerebral palsy as a paediatric condition. We now teach it as a lifespan condition, so that hopefully the physiotherapists of the future go out there having a better understanding, whether they're working with children with CP, or maybe if they've just got a general clinic, they've at least got a better understanding about the fact that many people with CP do experience aging, and what they can do to help those people manage their own condition and, you know, live, you know, healthy lives as they move forward. So there's sort of a two-pronged attack, but absolutely information is at the core.
Yeah, and that's really encouraging, Prue, because I know I'm a bit older than a young adult, but, you know, just to give an example, when when I was that age, what I knew was, yep, it's a permanent brain, damage to the brain. But then, once I was into my 20s, I'd be all right. So it's really good that this, knowledge is being spread and more research is being done, because it is a lifelong condition.
Yeah, and I think a few people have alluded to that in the chat about either experiences that they've had with health professionals who may not recognise that, CP does change over time, or to have a better understanding as to the lifespan care needs. And as I said, we're very much trying to tackle that by providing webinars such as this, My CP Guide. We're obviously also working very hard with providing information to GPs and offering GP training to help them upskill. So there are lots of things going on that we hope will make a difference, because, as you said, Wade, 10 years ago, no one knew anything about ageing with CP.
Mm-hmm.
Thank you all for that. We have just a couple of questions remaining here. And the first one, I believe this person is just asking with a general interest about neural fatigue. They're saying, what about the impact of neural fatigue, which is more than physical fatigue because it affects concentration and exhaustion? If anyone would like to jump in.
Do you want to take that, Carly?
Sure. There's research going on at the moment about fatigue, and I think the distinction between cognitive or neural fatigue and physical fatigue is quite difficult, and they one causes the other and vice versa. For instance, if you're having to concentrate very hard on your walking, that's going to fatigue you both physically and mentally. That's just one small example. And unfortunately, there seems to just be information about managing fatigue in terms of resting and planning out your day or week so that you don't overexert yourself.
And I would also add that, as you're, especially for those that are adults and they're used to walking independently, and they're noticing, that it's getting more and more difficult to walk. As you pointed out, Carla, then that's, your main focus is walking, and whereas that should be just something you're not even thinking about. And so in the last couple of years, I had a physio that assisted me on getting a mobility aid, so a walking frame. And that helped tremendously on relieving that neural fatigue and decreasing the anxiety. So, and it's something that I really didn't consider independently, but it's something that now in hindsight has helped me tremendously as far as reducing that overall fatigue, both neurally and physically, and helping me get out more as well.
Can I add that physio probably, after much deliberation, suggested it rather than insisted on it, knowing that it's such a really big step to go from walking independently to using an aid. So it's something to approach with sensitivity to therapists out there, and have that good conversation with the person that you're working with.
Yes,
Sorry,
definitely.
Wade.
Oh, it's all right. No, it's a very good point, Carly. And on that point, from a personal lived experience point of view, I really strive to be as independent as possible throughout my life. And so I really initially had issues with it, but and also I was like, well, people are going to see me with it. They're going to comment on it. The usual stuff that the people with CP experience every day. And it's been very interesting because I found that I get actually fewer comments now from strangers, people I don't know, kids, whatever, using a walking frame as opposed to when I was just kind of walking independently. So, and you're right, as someone with CP, especially the effort that we've gone throughout life, the extra effort that we go through every day, it is, you as a therapist, you should, be careful about suggesting it. However, I'll say that it has been a great benefit to me.
Thanks all for that. We just have one more question in our Q&A area before we conclude the session. It's a slightly technical question about muscle strength. And this person is asking, is there a balance that needs to be struck between building strength when muscle repair is impaired, or the benefits of building strength outweigh the muscle impairment?
Yeah, great question. And certainly also being very mindful of pain, potential joint instability. You wouldn't want to certainly load up someone with a very sort of heavy resisted exercise weights program without very carefully monitoring how they were progressing over time, which is why, even if someone is reasonably independent, it might be good to check in with a physio or maybe an exercise physiologist before you start doing perhaps a gym program, just because of those issues that you've raised, and also the concern about potential pain and joint instability. But I guess the short answer is slow and steady increments, and not rapidly increasing any resistance or weights, and just monitoring how that person's going. But great question. You do need to be very careful because of those underlying concerns.
Yeah, I would take a so much more conservative approach to starting a gym program with someone with CP than someone in the general population, like extremely conservative, and just to avoid pain, to avoid injury, and to keep the person engaged, because you're not going to be engaged if you go home and curse your physio for the next week. And it's always better to get there a lot more slowly than not to get there at all.
Thank you both very much. So we'll end the Q&A segment there. I just wanted to again quickly mention my CP guide, as was discussed briefly in the presentation. This webinar is one in a series of webinars that my CP guide is putting together. And if you are interested to attend others, if this is the first webinar that you've joined us for, you can subscribe to our email newsletter by visiting the homepage at mycpguide.org.au and subscribing to our newsletter there. You'll be notified when new webinars are coming around. And for everyone who is registered to attend this webinar, including everyone who actually made it to attend the live session today, you'll be sent a follow-up email soon, which will include a recording to this session if you wish to view it again in your own time, or if you wish to share it with someone who maybe wasn't able to make it today. And that will be available on the MyCP Guide website as well. So I just wanted to say thank you again very much to our presenters today, Prue and Wade and Carly. It was a really great presentation and discussion, and I know that we had a lot of interest in this topic. So thank you very much, and thank you to everyone who was able to attend today. I'm going to conclude the session there. Thank you.
Thank you. Bye-bye.
Bye.